think of women many times, we think of osteoporosis as being a main cause of problems later in life.
Yes.
But what kind of surprised me a little bit in the studies was osteoporosis also shows up in men as they get a little older. Why is that? Is that becoming more prevalent?
You know, guidelines in the past have actually stressed out more the importance of screening women for osteoporosis rather than men. In reality, the guidelines do screen females for osteoporosis. There is not a clear cut in regards to screening men for osteoporosis at this point in time.
Why don't we do this too, because we have a biodigital here and we have a screen that you have right there to your left. So let's show a little bit there about the osteoporosis here, because this is what we're talking about here. This is the bone deterioration in the femur, correct?
Yes, yes. This is a structure, the inside of the bone marrow. Basically, osteoporosis is just thinning out of the bone itself. The bone just becomes weak, and it could be easily broken. Just maybe having an accidental fall, maybe just falling, walking to your car in the parking lot. If you have a very weak bone or an osteoporotic bone, it will just easily be broken.
Is that the only way to diagnose, though, is if a bone breaks, or can you find out another way?
No. Going back to vitamin D, this is why it's important to take vitamin D supplementation. You could take 1,000 or 2,000 international units once a day. And depending on how low the levels are, then we may take a higher dose. But taking vitamin D does provide some sort of strengthening to the bone. To diagnose osteoporosis in the outpatient setting, what we normally send out the patient to is for something called bone density or DEXA scan, which is what really tells us if the bone is in the osteopenia, which is the prior stage to osteoporosis.